Hello. Now I am going to tell you about the complications of CAR T cell therapy. Now I already told that CAR T cell therapy is chimeric antigen T cell therapy, which means we train our own T cells against the tumors in our body. And by that way, they can identify the tumors and destroy them. But it is also associated with some complications. The most common complication is cytokine release syndrome, that is after CAR T cell infusion. There can be fever, there can be hypotension, there can be rigor, this kind of thing, and that should be managed, that can be managed very easily. The next complication is a neurological complication we call ICANS. So there can be some convulsion, neurological disorder after CAR T cell therapy, and that should be identified by monitoring and can be handled properly. And the third mode of complication, we call it cytopenia, that is the hemoglobin, white blood cell platelet count comes down. So that is an CAR T related cytopenia, and also we call it an HLH, hemophagocytic lymphohistiocytic reaction, because of CAR T cell therapy. So these are the complications, but not a very dreaded complication in most of the cases. Most of them can be managed very easily, but we need to be very vigilant after the CAR T cell therapy. But this is a very newer mode of therapy by which many blood cancers can be cured, and those cancers are, as I mentioned, B cell acute lymphoblastic leukemia, B cell lymphoma, diffuse large B cell lymphoma, as well as multiple myeloma. And we are day by day, the number of CAR T cell therapy are increasing in our country, so our experience is also increasing. And previously it was very expensive when the foreign CAR T cell therapy we used to procure and then treat. Now we have an indigenous Indian CAR T cell therapy developed in the Tata Memorial Hospital along with the Mumbai IIT, and that CAR T cell therapy is very cheap. And as we are doing more and more CAR T cell therapy, our experience of handling the complications are also more. So now we more confidently we can treat with CAR T cell therapy, we can handle the complications, and this is the future of managing blood cancers. This is a living drug which is going to change the way we treat blood cancer. Thank you.